Welcome one and all to today's program. I'm Irene Chansawang, Senior Grant Specialist at Maddie's Fund. And I don't know about you all, but even though the weather has cooled down a bit, I'm always feeling warmed up by our Monday calls. So thank you for being here with us today. Co-hosting with me is Nadia Oshigera, the California Program Manager at UC Davis Koret Shelter Medicine. Nadia, are you on the call?
Yes. Hi, Irene. What a warm welcome. It is very cold in LA, so thank you for that warm welcome. Happy to be here with everybody. And we're just going to kick it right off with our national updates because we have a great lineup and a great topic today. So to kick us off with national updates, I'm going to pass it over to Sharon with Maddie's Fund.
Thank you, Nadia. That was a warm handoff. I have 3 exciting announcements to make, and I will jump right to them. I want to see everyone. Okay, so first and foremost, I just want to give a save the date to everyone for our Open Arms Challenge for 2024. That will be coming in April 1st to the 30th, and that will kick off mid-January, so just put that on your calendars. Also, for those of you interested, Camp Maddie Foster Edition was held last week, and the recordings are now available. And you're going to get the links, will be in the chat. And then thirdly, I am so excited to announce, if anyone has seen it or not, but Dr. Quan Stewart of Project Street Vet was named CNN Hero of the Year last night in New York. I think he is the first veterinarian to receive this award. Cynda is nodding yes. So I tried to look it up, and I tried to look at all. This started in 2007, and there was another animal welfare. Sherry Franklin was a finalist, but he made it to the Hero of the Year. The interesting thing as well is during his acceptance or his acknowledgement speech, there is a prize of $100,000 to help further your organization. He decided to split it with all the finalists. So he said it splits 10 ways very nicely, and he wanted to do that for everyone. So he has a kind and generous heart. As we all know, if anyone doesn't know who Project Street Vet is and Dr. Quan Stewart, he was a speaker on community conversations, I think a few months ago, and just so excited. The winning was due to everyone's voting, so thanks to everyone who voted. So excited. That's all for me.
Also, thanks to your incredible promotions, Sharon. So thank you. And what a way to kick off our show, to show our love for and support for veterinarians today. Nadia, were there any other national updates that we were hoping to open the floor with?
Yeah, let's open it up for a couple more. If anybody has any and you'd like to unmute, we have time for 2 or 3 more. Alternatively, if you don't want to unmute, you can also drop your national updates in the chat.
Hey, it's Allison here from Maddie's Fund. Just a little promo for a couple of meetings coming up. We've got Maddie's Insights this Thursday on family bondedness. It's some research that Dr. Sheila Sagerson has dug up for us, and our guest will be on hand to answer your questions and give us a presentation. So that link is in the chat. And then next week, Ask the Expert, Diana Prado, not doctor, but Diana Prado is an advocate and a housing advocate. And I strongly recommend you to come on that meeting if you have any questions about evictions and keeping pets and people together, anything to do with housing. So a link is in the chat. See you there.
Awesome. Thanks, Allison. Any others?
Hi, everyone. I have an update I'd like to drop in. This is Jennifer from the Humane Society of the United States, and just wanted to remind everybody regarding advanced registration for Animal Care Expo 24 in San Antonio, Texas. That expo will be May 15th through the 18th, and we are accepting scholarships through January, and I'll go ahead and send those deadlines and links in the chat as well. Thank you.
Thank you. We have time for one more quick update if anybody wants to jump in.
Well, I'm ready to jump in. My name is Ellen O'Neill Stevens, and I'm the founder of Courthouse Dogs Foundation. And I am so happy to have this opportunity to share with you what our nonprofit does. If you have some time to hear from me about this.
Awesome. Thank you so much.
Sure. So the background to this, to the creation of this foundation is interesting in that it was not planned on at all. So as I mentioned, I was a prosecuting attorney in Seattle, Washington for 26 years. And so that's one aspect of it. During that time, not only was it difficult to see people suffering from trauma, victims, witnesses, etc., but also I was involved in drug courts. So I saw a lot of offenders that were having difficulty. And then we also have the staff also is impacted by the trauma that we see as well. So it is a situation that our courthouses don't accommodate very well in terms of decreasing the amount of trauma and going on during this practice. So that's the first part of it. The second part is that my first child, Sean, was born with cerebral palsy and was totally incapable of taking care of himself, but was just a beautiful person and very, very engaging, non-verbally engaging, always smiled, etc. So when he graduated from high school and got a standing ovation at graduation, I thought, well, what is he going to do now? Because he doesn't have these friends to support him. And that's where I got the idea of getting him a service dog. And him having the service dog brought people to him. And so it was a very happy arrangement for him as well. There was one day a week when his dog Jeter couldn't be with him. At that time, I was working in juvenile drug court. And the children or the teenagers there didn't particularly like me because I was the prosecutor there and demanded more attention from them than the other people involved in that. And so it occurred to me when Jeter couldn't be with Sean, I asked the judge if I could take Jeter to juvenile drug court. And it was just a huge success. Those kids started coming to drug court. They loved being with the dog during that practice. Soon after that, a prosecutor asked me if he could borrow Sean's dog to help these two little girls testify against their father who had sexually assaulted them. And I said yes. And then everybody wanted the dog. And that's where I got the idea of saying, no, you have to get your own dog. And so there was a prosecutor in there that applied for one of these dogs. And that was the genesis of starting this. And all of that happened in 2004. And so the dogs that provide this service are graduates from assistance dog organizations that are members of Assistance Dogs International. And it is critical that we have dogs with this degree of training that have been specially selected to do this type of work in order to include the dog in the investigation and prosecution of crimes.
Ellen, I'm so sorry. I hate to be rude and cut you off, but we do need to move the call along. We have these three veterinarians here who carved out time to answer some questions related to today's topic, but I would love for you to drop any links for your website or where folks can learn more. And thank you for being here today. So with that, I'm actually going to hand it over to you, Irene, so you can kick us off with today's panel. Thank you.
Yes, thank you so much for all of the national announcements. So this time of year, we're not only thinking more about our own health, but that of our pets and the animals in our care. So today we have a panel of experts to discuss practical steps to reduce respiratory disease risks in shelters from all the usual suspects, as well as the latest understanding of the mysterious respiratory illness in dogs that is making headlines. If I could ask each panelist to introduce yourselves, and please let us know where you work and your role there. Thank you.
Am I going first? I
I'll
guess
start with Dr. Cynda Crawford if you're.
Go ahead, Cynda.
Sorry, Dr. Crawford, we'll start with you.
Yes, can you hear me
Yes, perfect.
and see me? Camera working okay?
Perfect.
Okay. I am a veterinarian and faculty in the University of Florida Shelter Medicine program here in Gainesville, Florida. One of my, shall I go ahead and talk about the question you're going to ask me or just introduce myself?
We'll have introductions first, and then
Okay.
we'll move on to questions. Thank you.
And that's who I am and have been faculty in our shelter medicine program now for 15 years.
Thank you. Dr. Cynthia Karsten.
Hey, everybody. Great to see you. I'm Cynda Karsten. I am the Director of Outreach here in Davis, California with the UC Davis Koret Shelter Medicine Program.
Thank you. And Dr. Scott Weese, it is a pleasure having you on Community Conversations again.
Great, thanks. So I'm Scott Weese. I'm from the University of Guelph, Ontario Veterinary College, and I'm an internal medicine specialist that just does pretty much infectious diseases.
Oh, thank you so much. And I'll start with my first question to Dr. Weese. There has been a lot of information coming out very quickly about this mysterious respiratory illness. What is the latest information you can share that shelters and animal welfare organizations should be aware of?
Well, there's a lot that's unknown. And the question at the start was, do we have an outbreak of disease, or do we have an outbreak of talking about disease? And that's a challenge for respiratory disease because it's always there, right? We know kennel cough is always there. So I'm just going to back up a little bit so we're at the same place in what some of the terminology is. So kennel cough is a syndrome. We also call it CIRDC, or Canine Infectious Respiratory Disease Complex. It's dog cold and flu season, basically. So we've got a variety of bacteria, a variety of viruses that cause respiratory disease. So it's not caused by one entity, and that's kind of an important thing. We've always got these circulating in the background, and we always see little peaks and valleys. So you get a little cluster that occurs in a town or an area, and it could just be, one dog that's sick goes to a dog park and infects a bunch that go to daycare, and you see this little spike. So over the last, I think, couple of years, we've seen what we think is maybe a gradual increase in respiratory disease cases, and there are a variety of COVID disruptions that could be part of that. So when we've got an increase in kind of baseline, we've got our normal ups and downs. It makes the ups a lot more remarkable. And we're still trying to sort the issue out, but my leading guess is that's what we've got. We've got kind of a gradual increase in disease. We've got a normal ups and downs, and some of these ups have been fairly identifiable. And we know there's an increase. So if you look at some places, we've looked at insurance claim data, and we saw a nice increase in Oregon, for example, that coincided with when they were talking about things going on, and it's come back down. So it's hard to tease out sometimes what's going on. We've got this background noise that's out there, but this is probably something that's caused by the regular suspects doing their regular thing, just at a bit of a higher rate, probably for various circumstances. There's been talk about serious disease, and as far as we can tell right now, serious disease probably isn't a greater risk to your average dog than it was before, because if you say 100 dogs have kennel cough, or whatever you want to call it normally, we'd expect maybe 1 or 2 to get serious disease in kind of the broad population. So when you have 1,000 dogs that get it, we expect 10 or 20. So it's more identifiable, even though the rate and the risk are the same. So as more cases occur, we're going to hear about more severe disease. So I haven't seen any convincing evidence that what we're seeing right now is more likely to make any individual dog sick. We're just seeing more sicker dogs because we're seeing more disease. And maybe I'll wrap up shortly, just coming back to the mystery virus component. So we don't actually have evidence there's something new. There are a lot of places that are looking. They're doing methods now where you take a sample and you sequence all the viral stuff that's in there. Because we've normally got a background noise of lots of different viruses that don't cause disease or we don't really understand. And nothing really seems to have come out so far from what we're hearing. There's a lab in New Hampshire that reported a weird little bacterium, and they reported that back in the spring, actually, related to a mycoplasma, something that we see in dogs. And, it's interesting they found it in sick dogs. The question now is it relevant, or is it something that's just in all dogs, or commonly in dogs, including sick and healthy dogs? And this hasn't really been found elsewhere yet. So it was something that it's good they're investigating, as we need to understand it a bit more, but we are far from having the smoking gun for it. And either way, if this ends up being something that's associated with disease, it's probably new to us instead of new. And by that, I mean, it's been there for a long time in dogs versus this is a new thing. Like when canine flu hit in the US in 2015 from Asia, that was a new virus coming into an area where there's no existing immunity. So it took off, right? And I don't think we're seeing any evidence of that based on how the disease is spreading, the characteristics of it, and based on the testing so far. So just to sum that up, I'd say we don't probably have a mystery virus. We've probably got a normal thing. We truly have some increases, but it is sporadic. At certain places in the country, it's happening. Certain places doesn't seem to be. And it's often following the typical epidemic curve where it goes up and then it comes back down.
Great. That is probably a great segue to my question for Dr. Crawford. What respiratory illnesses are occurring in shelters now, and how do they relate to what we're seeing with this canine respiratory illness?
Thank you. So one of my roles in our shelter medicine programs for the past 15 years is helping shelters identify and manage infectious disease problems and outbreaks. Certainly, respiratory infections are the most common disease in shelter dogs. Everyone here on this call has experience with some baseline level of kennel cough in their organization on a daily basis. On average, our program assists about 15 shelters every year with the diagnosis, management, and resolution of respiratory disease outbreaks in their dog population. The caveat that I want to bring up at this time is this average of 15 shelters per year only represents our program. It does not take into account all the shelters out there being assisted by other shelter medicine programs and national organizations. So I'm only going to reference our program's experience with canine infectious respiratory disease in dogs in shelters most recently. But I will say over the years, canine distemper virus by and far is the most common culprit causing outbreaks each year. And this is followed in frequency by canine pneumovirus, canine influenza virus, and strep zoepidemicus bacteria, otherwise commonly known as strep zo. And these diagnoses are not anecdotal based on clinical signs or other criteria, but they're always confirmed by PCR testing of numerous dogs in each of the outbreaks. So in the 3-year period before COVID, we assisted an average of 10 shelters per year with distemper, 2 to 4 with pneumovirus, and 1 to 2 with strep zo. So I'm going to use this sort of baseline before 2020 for a comparison to what's happened since COVID. And I will say that I actually was pretty much out of a job during the 2020 COVID pandemic response, when shelters had the fewest number of dogs in the care. Many shelters didn't even have any dogs. And it's interesting because during 2020, during this period of mass relocation of dogs to foster and adoption homes, we saw the lowest number of disease problems in probably 10 years. And for instance, that year, I only worked with 4 shelters, 3 of which had distemper and 1 with pneumovirus. And that was it for the entire year. But the landscape changed in 2021 when the number of shelters with respiratory disease outbreaks that I worked with markedly increased from 4 to 44 in 2021, 35 in 2022, and 25 in 2023. And again, this does not count all the other shelters that I personally did not work with. During 2021, 2022, and through 2023 to date, we've helped 10 to 35 shelters with distemper only each year, each of those 3 years. 8 with pneumovirus each of those 3 years, and 3 to 6 with strep zoo. Since 2021, I have observed a steady increase in number of shelters with pneumovirus outbreaks, where 70 to 90% of the dogs become ill. And I see there's a couple of you on this call that I worked with when they had pneumovirus in their shelter, and I'm sure they can attest to the very large numbers of dogs that do become ill from pneumovirus. Unfortunately, several shelters have experienced more than one bout of pneumovirus. It keeps recurring. They get rid of it, then it recurs. And they decided they just can't continue to devote resources to trying to eradicate the virus. So as a result, they have accepted pneumovirus as an endemic pathogen in the shelters. And this is resulting in a higher incidence of illness on a daily basis than they had before pneumovirus became endemic. What I've also observed, besides the increasing frequency of pneumovirus, is that the pneumovirus seems to have lost a lot of its punch. Prior to 2021, this virus caused a pretty prolonged respiratory illness, often lasting more than 2 weeks. And each shelter with pneumovirus would have several cases of pneumonia, and a proportion of those would die due to the severity of pneumonia. What we are seeing now with pneumovirus that's circulating more frequently in shelters is that it appears to be less virulent. It's causing a milder, shorter illness that the vast majority of dogs recover from, and there's much fewer or even no pneumonia cases in each instance. And we expect this reduction in virulence of a pathogen when it starts to increase circulation in a population. As a matter of fact, I expect that canine pneumovirus will follow the same path as an older respiratory pathogen in dogs known as canine respiratory coronavirus. And respiratory coronavirus, when it first started in shelters in the mid-2000s, it caused a lot of dogs to be sick, and the illness was prolonged. And there were some that developed pneumonia. That doesn't seem to be happening with coronavirus anymore. And I think that's kind of the way that the pneumovirus is going to go. And I think it will become one of the endemic causes of canine infectious respiratory disease in shelters moving forward. What's more alarming to me is the increasing frequency of strep zoo in shelters since 2021. In the past, we would work with 1 to 2 shelters a year with strep zoo. In 2023, we've worked with 7. And this includes a cluster of 3 shelters recently that documented an outbreak of strep zoo, all within a 1-week period of time, even though they were all in different states. So strep zoo is, I think, emerging as a more frequent cause of respiratory illness and death in shelter dogs. It's a pathogen of concern because it causes severe bleeding in the lungs, and most dogs die within hours without any warning. And again, there's some on this call who have lived through strep zoo in their shelter, and it is very scary. In the past, we usually found strep zoo occurring in dogs that either had the Stemper pneumovirus or influenza infection. So it seemed to tag along as sort of a secondary co-infection with these 3 viruses. But now we are seeing strep zoo in shelters where we cannot identify any underlying infection by a virus. So just to summarize as to what we're seeing now with shelters is that the number with respiratory disease outbreaks has substantially increased since 2021. And this, if you think about it, this correlates with the increased number of dogs in shelter care that every shelter is experiencing right now. And these are numbers that far exceed the housing capacity and the capacity for care. And we do know that very dense dog populations due to overcrowding are a huge risk factor for disease outbreaks, especially respiratory infections. And as of 2023, the emerging pathogens causing more and more outbreaks in shelters are canine pneumovirus and strep zoo, at least in our experience. We have not identified any respiratory outbreaks that had an epidemiology suggestive of a virus, where we did not identify either distemper, pneumovirus, or flu. So we have not worked with any shelters to date that had a respiratory illness sweep through their population, and the cause could not be detected or associated with this outbreak through PCR testing.
Thank you so much, Dr. Crawford. And so, Dr. Karsten, from a shelter management perspective, what are 2 or 3 strategies that shelters can implement today to help mitigate any of the risks associated with this illness, or perhaps the ones mentioned by Dr. Crawford?
What I wish more than anything for this holiday season would be that I could give you all like magic wand to just be rid of this. But as Dr. Crawford said, it was not coincidence that in 2020 we didn't see disease. When we have high shelter populations, we will see an increase in disease. That is never a mystery. So we have to be mindful of how dense our populations are. And because the other important things we need to do are, first of all, we have great vaccines for some of the main pathogens that we're talking about, mainly distemper. It's a good vaccine. In an adult dog, one vaccine will be protective, and it will start to be providing some protection really quite quickly, within hours of giving that vaccine. So we have to do it on intake. When we say intake, we mean intake. Intake is not the first 24 hours. It's before they enter the general population. Modified live, reconstituted right before we give it to an animal. We don't want to be, it seems like a time saver, but we shouldn't be reconstituting all our vaccines in the morning and giving them throughout the day. We want to pull it up and give it. And then make sure it gets in the animal, not intra-fur. Those don't work very well. So ensuring every single animal who enters our shelter gets a modified live DHPP, and then also the 3-way Bordetella. So Bordetella, parainfluenza. Holy cow. And no. Of course, I was gonna, trip up on that one. As far as influenza vaccines, at this time, at least our program does not recommend giving it in shelters. Reason being, it's too late, because you do need 2 vaccines for that to be protective. And by the time they get the second vaccine, they've probably already been exposed. So that being said, if you are doing community vaccine clinics and you're seeing a lot of influenza in the area, that might be the place you want to include it, but not on intake. Okay, so along with the intake vaccines, what's really important is to be really mindful and have staff trained on what to look for respiratory disease. So how does respiratory disease clinically present in animals, and being able to identify it right away. So either on intake or on when daily care is being provided. So really good monitoring. First of all, on intake, but then every day that the animals are in our shelter, because the earlier we identify it, the earlier we can do something about it before it starts to spread. What do we do about it? Here's the most important thing that we need to be doing. We have to isolate these animals. So another reason that we need to be really mindful of our population is we have to have the ability to isolate. If not, the ward that the animal is in now becomes one of your isolation wards. So either that needs to turn into the isolation ward, and that's where all the sick animals need to go, or you will soon find yourself with a ward of sick animals. So another reason, if I hope this is an if and is happening with many of you, you are trying to actively pass some measures, be those ordinances or practices, but you're looking for more reasons to manage the population size within the shelter. Use this opportunity of a mystery virus or fear that you've heard from other shelters about seeing more disease, because our program too, I've answered way more calls than I want to about strep zoo, as a time to say we have to manage our population. These diseases peak and some only show up when we are over our capacity for care, or just plain over our capacity. So this is a time that we have to be looking at how many animals we're caring for at one time, because we have to be able to isolate. We have to have isolation wards, or you will soon find yourself with those shelters full of sick animals.
I am definitely hearing you. I think that you've all provided some great clarification and some strategies going forward, whether how easy they are to implement. Of course, that I think takes community. But before we head into some questions from the audience, and we have quite a few, I wanted to ask you three if there was anything else you just wanted to share kind of off the cuff before we, again, go into Q&A.
I think the questions will hit most of it. I just wanted to echo the comment about vaccination, the 3-way vaccine, or at least the 2-way vaccine, how important that is versus an oral Bordetella only vaccine. Like people often consider kennel cough to be the same as Bordetella, and Bordetella is one component of kennel cough. And we look from our surveillance in Canada, which is similar to a lot of places, Bordetella is number 2 or number 3 on the list. Paraflu tends to come up as the leader. Again, a respiratory coronavirus, Bordetella, but as Cynda said, pneumovirus, probably coming up there too. So like Bordetella is an important player. The vaccine's really good, but if we can protect them more than just one of those players, we want to do that. At least that's my approach to it.
I guess I'd like to add that I agree with Dr. Weese's analysis of what might truly be happening in the pet dog population with regard to, yes, there is a very noticeable spike in dogs with respiratory illness, and it's most likely due to something, that a pathogen that's already been identified for dogs. And I think that's the same situation in shelters. When the increasing frequency of respiratory infections, it's more than a spike, though. It is a steady increasing trend in number of shelters with sick dogs. And you could probably plot that trend line against the trend in number of dogs housed in shelters every day now, which is, in the hundreds. Some shelters have 800 to 1,000 dogs in their care every day. And yes, they have recurrent diseases. But certainly it happens in shelters with 50 dogs on site if they don't have the preventive healthcare processes that Dr. Karsten outlined. But I'm very grateful that there is such large interest on the part of veterinary diagnostic laboratories to look for new pathogens, sparked by media coverage or not, because actually the last 3 new respiratory pathogens discovered for dogs has been in shelter populations.
Thank you for emphasizing that, Dr. Crawford. Okay, so I will kick it off with some questions from the audience. And if we don't get to all of these questions, these great questions, we will be posting them in the Maddie's Pet Forum for our wonderful panelists to be able to address a later time. So is there any evidence that cats are affected? For example, a cat sharing a household with an afflicted dog, or other evidence of an increase in cat respiratory diseases?
I can't address that because I work with shelters instead of dogs and cats in pet homes.
Yeah, I wouldn't say we're really observing that, or at least I'm not seeing it or hearing it. There are, again, kennel-Costa syndrome, a lot of different things. There's potential for some transmission to cats, but overall, it doesn't seem like a big concern to me.
Okay, because someone did also ask, we know that cats are highly sensitive to respiratory illness. So if a dog may have a respiratory illness, what should a foster parent do if they have a cat in their home?
Well, I think just a good general tool is isolation. And we look at physical isolation and procedural isolation. So keep them physically apart and try to limit cross contact. And this is a challenge when you've got a foster that has their own animals. There's always going to be some degree of risk there. And dog to dog could be greater risk than dog to cat. But it's going to be there. And I think with new entry into foster and with animals that are sick, we want to take an extra level of precaution. So the risk is probably low. So you have to think about the risk versus reward, and locking the dog in the bathroom isn't usually what we want to do for lots of reasons, right? But we want to figure out, how do we minimize the contacts, minimize the high risk contacts. It would also depend a bit, and we didn't really get into this, that respiratory disease typically doesn't cause severe disease, but it can. And where do we see it, whether it's a dog, a cat, or a person? Well, we see it in older individuals, the very young individuals that have heart or lung disease, that are immunocompromised, and with dogs, the flat-faced breeds. So if you've got another dog or another cat in your household and you're fostering, if you have a high risk one, then you should be rethinking maybe who you're fostering. But if you have a high risk animal for getting really sick, then you want to be a little more strict in how we're keeping them apart at the start or when they're sick. Because, if a foster infects a 14-year-old lab, that's got a lot greater chance of causing severe disease in that 14-year-old lab than if that lab was 4 years old.
Can I just add one thing to that, which made me think of something, Scott? Was that in general, too, just thinking about the overall coping mechanisms that we give animals. So I always think about that when like if someone has a cat at home and another animal comes in, is how well can that cat cope with something new? Because for cats, certainly stress is what causes more disease than anything, honestly. And so, but same with dogs. So how well, when our shelters are high in population, what tools can we give animals to cope? Because that will help. It's not the answer, but it's something. So the more tools an animal has to cope with the stress that they're experiencing, the better off they'll be in fighting disease. And that's the same in a foster home as well.
As a rescue that pulls from their city shelter and puts animals into foster homes, what should they do to ensure the safety of those animals that were not in the shelter and exposed?
I think one thing to realize is that if your shelter has pneumovirus or flu, influenza virus circulating through the dogs, I would be very hesitant to place dogs in the shelter that have been exposed, may not be sick, but exposed. I would be hesitant to put them in foster homes with resident dogs, because those are just highly contagious, and most dogs don't have pre-existing immunity. So certainly I would place them in foster homes without resident dogs. Distemper, I would place distemper infected dogs in foster home also, even if they have resident dogs, but only if the resident dogs are adults and have a track record of multiple vaccination against distemper. Certainly those distemper dogs are going to recover quicker in the home as opposed to the shelter.
I'm watching some of Nadia's questions as she filters them out. I'm going to ask this kind of even from a personal perspective. If my dog is vaccinated and up to date, should I be taking him to dog parks right now, or is it best to avoid that? We talk about risks and mitigation.
Well, everything's cost benefit in life, right? So I took some risk driving in today, but there's a value for me to do that. And I think we have the same thing with dogs. We need to think about that a little more broadly, because we do it all the time, right? But if you're going to the dog park, what's the value of going to the dog park? What's the risk? So on the risk side, part of it's understanding the disease in the area. So if there's a lot of disease in your area, then the risk goes up. If you have a dog that's at high risk for complications, then the risk goes up. So if I hear dogs are coughing all over the place, it's all over Facebook, I've got a 14-year-old lab that's on chemotherapy and has lung disease, I'm not taking him to a dog park. Because a 1-year-old lab I've got one of these, I've got both of these actually. I've got the 12-year-old on chemo, and I've got the 1-year-old crazy dog that I want to tire out. So, I would be more willing to take him, realizing there's some crossover risk there. Same thing with boarding. Like if you need to go to work, take your dog to daycare. Make sure it's a good daycare. Make sure your dog's vaccinated. If they're sick dogs, don't take it. Like, I think that's how we try to mitigate the risk. If it's just a matter of, oh, it's not really important, there's a lot of disease going on in the area, then maybe we skip the daycare or the boarding. So we have to kind of balance all those things out. And there's not one answer for everyone. And there's not one answer for every dog in a multi-dog household. But I think it's just a matter of thinking about, what are the odds your dog's going to get exposed? What are the odds your dog's going to get really sick? If it gets sick, what's the benefit of whatever's happening, whether it's going to a park or a class or a kennel, and are there other ways to do it, reducing that risk?
I'm going to have to board my dogs in a couple of weeks. So I'm willing to take the risk. Because I do think it's going to be, this whole situation will be common things occur commonly. And we can thank the media for increasing awareness on the part of pet owners about risk factors associated with exposure to respiratory pathogens. But I think, the awareness of the risk factors, as Dr. Weese pointed out, and applying that to your own sort of risk reward situation. Certainly, if you and your dog are part of a pretty stable group of dog owners that go for pack walks or go to a daycare center or do social activities together, continue. It's not a situation characterized by being exposed to dogs from unknown sources with unknown medical histories. So your little stable groups should be good.
Yeah, I appreciate that. And I know that people are thinking about, for travel in the holidays, about boarding their pets. So there are things to consider. This is another question I'll jump to, just because as we talk about being in the community, what's a quick thing to say to people in our neighborhood Facebook groups or in person who are sharing panicky posts and information about the mysterious dog illness going around?
I'll take that. I want me to jump into that one. Well, I guess one of the things is, Facebook's good. Like Cynda said, raising awareness has been really useful, but it's raising paranoia. So I think pointing towards good resources that are out there. Various state and provincial associations have put out information. My website, we put some regular things. So trying to get balanced perspectives there. And for me, when I'm talking to people that are really freaked out, one of the things to think about is, okay, how many sick dogs are in your town normally? Like, respiratory disease is always out there. It's always circulating around. So, there might be 500 dogs in Guelph where I am coughing every day. I have no idea what the number is because we never look, right? And normally we never hear about any of them unless it's your own dog. But then all of a sudden people start talking about my dog's coughing, gets on Facebook, then we find out about 100 of the 500 dogs. We go, holy crap, we got 100 sick dogs, when really we have the same number of dogs we had last week. So I think that can be useful to put things into perspective a little bit. And I think pointing to resources is really useful, and independent resources where you've got some explanation of why, and people don't want to be told, no, there's no big deal, or the sky is falling. We want to explain the why. So people don't want to read reams and reams, but I think a place they'll say, okay, yeah, we know there are concerns, something's going on, but you know, the sky's not falling.
And to remember that the overwhelming vast majority of dogs that have a respiratory infection, it's mild and transient, and they recover without complications.
That is helpful. Are you seeing more of the current respiratory infections in puppies and senior canines, or in between, or all?
I don't think we know. I don't think we're relying on anecdotes. We've looked at some insurance claim data and we're trying to pull some details out. I think I'd be pretty confident to say we're seeing more severe disease in older dogs, because that's what we always see, right? If you look at with influenza, when we had it up here, our deaths were senior dogs. We don't have as much experience with flu in Canada because we haven't seen it as much. But with any respiratory virus, we're going to see it in the deaths. We'll typically see them often in older dogs and in brachycephalic. And, you know, with French Bulldog being the #1 dog breed in the US right now, that's probably driving a little bit of our increase. We just have more susceptible dogs, and we've got changes in how we've interacted with them over the last couple of years. We've had disrupted vaccinations from COVID. We've got more people starting to go back together to daycare where they haven't in the past, with daycare being a big trigger for getting vaccinated. So we've got more dogs with lower immunity and maybe some higher risk dogs out there. So all these things come together can partially explain why that increase might be happening. Like Cynda said, in shelters, is pretty tightly correlated with a lot more dogs in there. So you get bigger susceptible population, you get more disease. Same thing in the commuter, bigger susceptible population, we're going to get more disease. So I think I didn't really answer the question. So I don't think we're seeing more of it. It's more overall disease in puppies or older dogs, but I think we're probably seeing more severe disease in them just because they're going to get more severe disease when they get any respiratory infection.
Sure, thank you for that. And then it looked like Dr. Crawford had touched on this briefly, but could maybe elaborate on best testing practices? Would it be PCR, culture, or both?
Generally, we start with PCR because with collection of 1 or 2 swabs from an ill dog, you can submit them to diagnostic laboratories that have the capacity to detect all the known canine viral respiratory pathogens, strep zo and Bordetella bacteria. So, and you get your answer back in 3 days or so, which makes it a timely turnaround time for not only managing the individual dog, but the population as a whole. And remember, if you work in shelters, you are treating 2 things, the individual and then the entire population of dogs in that shelter. So to catch the shedding, well, I'll say there is a very narrow diagnostic window for detection of most known respiratory pathogens, and that is the first 4 days of illness. So first 4 days after onset of sneezing, snotty nose, cough. This is the window when the pathogens are shed in the greatest amount. And then it peters off from there. So that's one thing to remember, is that narrow window in order provided for sample collection. And then generally, we advocate for collecting nasal and oropharyngeal swabs from each dog and submitting those to a laboratory that has a comprehensive canine respiratory pathogen PCR panel. And so you have to check that out too, to make sure that the lab you're looking at isn't offering pneumovirus, is offering strep zo, in addition to the other pathogens.
I think the comment about early sampling is so critical, and I think we can't emphasize that enough, because we see a lot of money wasted on sampling. The dog's been coughing and it's still coughing a week or so later. Doesn't have an infection anymore, probably. It's got inflammation. Like we see a lot of people on this call probably had COVID and coughed for a couple of weeks after because your lungs are still unhappy. You're not going to find a cause there. The other thing I think on a testing standpoint, just because it's expensive, is the first question is if we should do it. And like Cynda said, like this is a population tool, probably more than an individual animal tool. So if you've got a dog that's gone right into foster and it's not going into the shelter ever, it's going to foster and then going to a home from there. If it's got respiratory disease, there's not really that much value. It's always interesting to know, but it's very rarely going to change what we do with that dog unless it's strep zoo. And if it's strep zoo, we're going to know clinically. If this dog has gone, you know, really seriously ill really quickly and it's been in contact with others, then we're worried about strep zoo. But if it's our typical kennel cough, the result's probably not going to change what we do to manage it. It's not going to change what you do in the shelter versus all of a sudden we got 3 dogs coughing in the shelter today that weren't before. Okay, what's in the shelter? What do we need to think about in isolation? What about vaccines? What about duration of shedding? So it's a more useful when trying to figure out how we manage the population, at least from my standpoint. And you guys may have better comments than me on that, but thinking about what we're going to do with the result. I never want to spend money on a diagnostic test if I don't have a plan to use the result. And that's got to be different for a positive versus a negative.
Yeah, from a population viewpoint, it is very important to be able to identify the likely cause. Because the properties of that pathogen are going to dictate how long you isolate actively ill dogs and how long you quarantine those that are exposed but don't yet have clinical disease.
Thank you so much, Dr. Crawford, Dr. Weese, Dr. Karsten. I can't believe we're out of time. This conversation has been so informative. So thank you for sharing your knowledge with us. I did capture all of the questions, so we'll keep the conversation going on the Maddie's Pet Forum. Thank you, everyone, for attending and for submitting your questions, and we will see you next week. Take care, everyone. Have a good rest of your week.
Thank you.
Thanks, everyone.
Thank you so much.